Hello again, I'm Army Pikett, and this is Blood Gas of the Week, case number 8. A 3-year-old male-castrated domestic short-haired cat is presented by his very worried owner. He's been missing for the last 2 nights and came home this morning. He ate well when he came home, but he's been sleeping since then and doesn't want to play games. On physical exam, the cat is bright, alert, and interactive. He's interested in investigating the exam room, including trying to climb into the cabinets and playing with paper towel rolls. Aside from being a bit overweight, his physical examination is completely unremarkable. At the owner's insistence, you perform blood work. So, here's his blood gas. The first step is always to decide if this is arterial or venous. This is labeled as a venous sample, so we're going to move on to the acid-base analysis. First, we're going to look at the pH. This patient's pH is 7.36, which is in the normal range. A normal pH can indicate a normal blood gas status, or it can be a mixed acid-base disturbance. The most common error people make when interpreting the blood gas is to see a normal pH and assume there is no acid-base disturbance. The only way to know if this is a normal blood gas or not is to assess the metabolic and respiratory components and correlate those to the findings on the exam. So, let's look at the respiratory component. The PCO2 is 42, which is a normal PCO2. Likewise, when we look at the metabolic component, we see the bicarb is also normal at 21. So, things are looking pretty normal. If you prefer the tic-tac-toe method, we see that our pH is normal, the CO2 is normal, and the bicarb is also normal. All 3 things line up in the normal column, so this looks like we have a normal blood gas. That leads us to the last step, which is to ask the most important question of this whole thing, which is, does the normal blood gas result fit with this patient's clinical picture? This is a really important question to ask yourself when you have a normal blood gas. It's possible on very rare occasions for a really sick patient with multiple mixed acid-base disturbances to have normal numbers for the pH, PCO2, and bicarbonate. It's rare, but it can happen. This happens because of the really complex interactions of multiple disturbances and the body's compensations for them. For this reason, you should always ask, knowing what I know about my patient, does it make sense for this blood gas to be normal? If the answer is no, then we need to do other things like apply semi-quantitative analysis for the blood gas or the strong ion difference or some of the other more complex blood gas analysis techniques in order to suss out the problems. In this case, we have a cat who seems to be quite okay. His physical exam is normal. He's acting normal in the room. He probably just needs to sleep off his nights on the town. So, in this case, the normal blood gas indicates that there is no acid-base disturbance occurring. So, that's it for this week. If you have any questions, please let me know. Otherwise, keep the rubber on the road and the blood inside, and we'll see you next week.